Welcome to Peptide-proof, your source for rigorous, independent, evidence-based peptide intelligence. Can topical peptides really replace peptide injections? Jennifer Aniston's beauty routine raises the question.
So mainstream media coverage of the 57-year-old actress and her peptide treatments has completely fueled this massive spike in anti-aging injection trends for 2026. We're seeing it everywhere, from Yahoo to Time to The Independent. The hype around peptide shots is basically at an all-time high right now. But here's the thing. As regulatory scrutiny tightens around these injectables, we really have to ask ourselves a pretty critical question. Are clinical topicals actually a viable, safer alternative? Let's go ahead and dive into the data.
Take a look at this data from the New Beauty 2026 State of Aesthetics report. It perfectly illustrates this massive knowledge gap we're seeing in the market. While 81.4% of people are aware of semaglutide and a solid 60% confidently claim to know all about peptide therapies, well, only 17.3% actually understand them. I guess nodding along at dinner parties doesn't exactly equal medical comprehension, right? So we end up with this environment of incredibly high heat, but very low comprehension. And unfortunately, that specific gap is driving consumers straight toward high-risk, unregulated treatments.
And let me tell you, those risks are very real. This brings us to the harsh reality of the current injection craze. What all those glowing celebrity profiles tend to gloss over is the gray market. Take BPC-157, for example. It's a hugely popular peptide in longevity clinics right now, but it literally has 0 FDA approvals for cosmetic anti-aging use. Regulators are actively chasing this trend. In fact, back on July 23rd and 24th of 2026, an FDA advisory committee actually voted to place BPC-157 on the restricted pharmacy compounding list. And honestly, what's even more concerning is that clinical dermatologists like Dr. Daniel Schlesinger are actively sounding the alarm. They're finding that fake vials bought online are routinely testing positive for heavy metals, with levels of arsenic and lead that far exceed any acceptable safety limits.
To really understand what's going on in this space, we have to look at the fundamental, unseen divide between injections and serums. It's like a flowchart with two very different paths. On one side, you have the injection route. We're talking about systemic drugs here. They enter your entire body, their long-term effects are honestly largely unknown, and they operate in this high-risk gray market that's subject to strict FDA medical oversight. Then on the other side, you have the topical route. These are categorized as cosmetics. They act locally, right on the surface of your skin, and they are governed by established, well-understood safety standards. The core takeaway here, you simply cannot compare the claims of an injection to the claims of a serum. They are playing by entirely different rules.
Beyond the headlines.
Into the research. Peptide-proof.
When you actually compare the risk profile and the evidence baseline for both, the contrast is pretty stark. As you can see, with systemic injections like BPC-157, you're dealing with a massive FDA gray area, completely unknown purities, the very real risk of heavy metals, and evidence that is mostly just emerging or frankly purely anecdotal at this point. Now contrast that with topical peptides like Matrixel. Here you get a localized mechanism right on the stratum corneum. The risk profile is super low because they are thoroughly dermatologically tested, and instead of just relying on anecdotes, you actually have this strong accumulating baseline of real clinical data. Now, let's be absolutely clear about one thing. Topical serums aren't just hope in a jar. They actually act on 3 highly specific, verifiable biological pathways. First up, we have the collagen switch. This is driven by peptides like Matrixel, which essentially mimics the skin's natural healing response to trigger new collagen production. Second is the antioxidant delivery system. This utilizes copper peptides, like GHKCU, to deliver essential trace minerals deep into the skin. And third, we have the Botox alternative, where peptides like Argireline partially block the snare complex to gently relax your expression lines.
Let's dive just a bit deeper into those specific, localized mechanics. Take acetyl hexapeptide 8, better known as Argireline. It literally mimics the SNAP25 protein to intercept muscle contraction signals. And we have solid 12-week clinical studies demonstrating a measurable softening of dynamic wrinkles with absolutely none of the systemic risks of using a needle. Then there's copper tripeptide 1. This one brings decades of solid regenerative data to the table. It effectively combines the specific wound-healing signaling of a peptide with the raw antioxidant power of copper to firm up the skin. Again, this is a localized cosmetic application providing real, noticeable results without ever crossing into drug territory.
You know, if you really want to know where the industry is heading, you just have to follow the money. And Big Beauty is betting heavily on topicals. Major industry players are investing serious capital into these localized formulations, not those unregulated injectables. For instance, Zeo Skin Health is redefining non-invasive firming with their peptide facial refining concentrate. SkinCeuticals just launched PTOX, which is a premium cream really pushing the boundaries of wrinkle-modulating science. And even in the mass market, Kenvue reported a 5.1% beauty sales growth in Q2, and they directly cited peptide product lines from brands like Neutrogena as a primary financial engine. So the market is absolutely validating the science of topicals with actual tangible revenue.
So bringing this all together, can skincare truly replace the needle? Well, there's no direct equivalence between a systemic injection and a localized serum. They are just completely different tools. However, as the FDA crackdowns on compounding pharmacies accelerate and that gray market just gets riskier and riskier, verified cosmetic topicals offer a low-risk, highly scientifically transparent baseline. For any consumer who is even slightly wary of the current injection craze, clinical serums are without a doubt the smartest and most reliable starting point.
The science is clear, but ultimately, the choice is yours. Will you gamble on the gray market or trust the transparent, localized science of topicals? That's all for this episode. Like and comment Peptide to receive our materials. Thanks for watching, and we'll see you next time.